Couple options. So, don't leave your patient like I am now. Okay, so these are our options. She can wear a brief, but we only use that in an absolutely last case scenario, okay? You can understand the implications to wearing a brief. Most people consider them a diaper, okay? This is a female urinal, okay? I'm going to show it to you, but it is very difficult to use. It goes like this, so you have to put it in and get the labia around it, and like get the urethra bang on there. It's not easy, okay? And especially with women who've had hip surgeries, they can't get their hips to go out that way. It's very difficult. So this is the female urinal. You'll probably never use it again, but this is what it looks like. Okay? I spent some time trying to get that baby to work. Don't waste your time. It's very difficult. This is a male urinal. Okay, they come with a lid. You've maybe seen this if you've been in the hospital. We'll often leave them on the bed rail. We'll tell men to go ahead and void in there, and then it has the graduation here. So we say ring for us, and then we can empty it. We can track the output, then we'll spray it with the Virox, rinse it out, and then dry, and give it back to them. Okay? It's really like, you know, they leave them on their bedside tables. That's where they work and eat. So really be on top of this. It's pretty gross to think what could be going on with it. Okay? And for men, it's really easy. They just sort of lay on their side, or some can even do it laying on their back. Just put your penis in, and then go ahead and void.
So do they like put the, like, do they just do it?
They just do it.
Like whenever, like they'll put anyone in there, they'll just whip it out. Alright.
Well, they're under the covers.
Okay, I didn't know if it was like, they can.
But no, to be honest, sometimes I'll walk by.
all of them or something?
Well, sometimes they do. Some of them will stand at the bedside and void in here, and they're just.
Like you can.
Some people just don't mind. So, anyways.
Okay.
Okay.
Yeah, just wondering.
Now here's our other option are two different types of bedpans. This is your classic bedpan, okay? And this is called a slipper pan. Notice how it's angled, all right? Now, who would be a candidate for each one? Any sort of hip surgery, okay, where you can't be put up on something and have pressure on like your back or your hips, maybe even your knees. The slipper pan is a better choice because it just sort of slips underneath, okay? The bed pan is a little bit more difficult, a little bit more uncomfortable to get on, so depending on your patient's mobility, they might not be able to get on this type of pan. Okay, so you'll have to make the decision. In the hospital, what we have are a plastic mold that looks just like this, and then we have a product that goes inside of it. It looks like, you know, the containers that hold your drinks?
Yeah,
From Tim Hortons,
Yeah.
that material. It goes right over this, so it will basically you'll pull that out, and then you'll put that in the macerator, and then you'll wash this. Okay, so we have macerators, and that's what we use. So the bed pans need to be lined with those.
What's a macerator?
The macerator is like a huge sort of garbage disposal. You put it in when you close it. It like chews it all up, and it goes into the septic system. Yeah. Okay, so then it's kind of nice when the dirty utility room isn't full of like, you know, yeah.
Shit.
Yeah, basically. Yeah, basically. Okay? So, the slipper pan. Now, what you want to make sure is that you put one of those absorbent pads under your patient. Most of our patients have them already, but you're going to want it this time because you don't always hit the pod. Okay? So, a couple different ways we can do this. So, if your patient can tolerate doing this, you can get them to put their knees up. And go ahead and lift your bum. So try and touch my hand. And then you're going to go ahead and sit back down.
Oh, that is uncomfortable.
It's very uncomfortable. Okay? Now this is what you're going to have to do. I'm sorry, Claire, but you're going to have to look and make sure that it's not too far underneath because the female doesn't have anything to poke down. So it's going to go flying this way. Okay? So I just tell you this because I want to help you prevent lots of spills and such. We actually, okay, I'm going to get you to lift your bum up again because I actually think we're too far. Okay, go ahead.
And let's say she did have hip replacement
Yep.
surgery. Would you still try to get her to lift herself up like that? Or
She probably can't tolerate it. So she
So
might.
how would you get it underneath?
So I'll show you in a sec.
Okay, sorry.
Okay. You want them to be sitting like on a toilet. So if they can tolerate being upright, that's how you want it. Okay. So we'll get her up as high as she can tolerate. We'll provide her privacy. We're going to give her her call bell so she has it. And we're not just going to stand here and be like, okay, go. Pretty uncomfortable, right? So we're going to pull the curtains and we're going to go ahead and make sure she knows to give us a little ring when she's finished. Okay? So let's now show you how to do this if they can't get on the pot like this. The pan. I call it the pot. I'm sorry. I don't know why.
Quick question.
Yeah. Just fire at me.
Is there a weight limit for those? Because they're plastic, right?
No. They're okay.
Oh,
Yeah,
okay.
we've put a lot, various sizes on them. They're good.
Okay.
Okay. Now, she's had a hip replacement. Okay?
I just have a question. What if like, because those aren't very big.
No.
Yeah.
So like,
So when
do
she
they ever
sits,
overfill?
yeah, they can. That's why you want to have that absorbent pad. The pans are really difficult. You're gonna have spills.
Yeah.
Yeah. Yeah, you're gonna. And so what sort of happens when you're laying there is it tips like this and it will collect in here. And then it's okay, but then when you go to take it out, it gets stuck a little bit. And so, yeah, I'm just going to tell you there's going to be some spills, so that's why the absorbent pads underneath will save you some time. All right? Now, let's say Claire has had a hip replacement on this hip, okay? We always want to make sure that we roll our patients away from their affected side, okay? There will be times when she will have to lay on that side, but it'll be for a very short time. Okay, so if I have to choose which side am I going to roll her, I want to be standing on this side, so this hip will go up. Okay, so that she'll be on her unaffected side. If somebody's had a hip replacement, what else do we need to think about?
What
Pressure
box?
points.
Pressure points, okay, blood clots, yes, but in
Pain
regards
meds.
to this, pain meds. So if your patient had any sort of pain medication right now, you might want to give them a little breakthrough. Okay, but you want to support this limb, because when you go over, it's going to pull down here, and it's going to pull on her hip. So you put a pillow between their legs, so that when you roll, it's going to have some cushion and support her hip. Okay?
When you put the pillow between your legs, and because they're not wearing anything,
Yeah.
would you put some kind of protective barrier
No,
over the
you know
pillow?
what? You can change a pillowcase, and the pillowcases are all the pillows are all plastic, so you can spray them down.
Oh, okay.
So you can just change a pillowcase. Okay, so we're going to get you to roll, and this is going to be very much on the count of 3, because we need to move all at the same time. We're going to put this underneath. So once again, we're going to line up, all right? And we're going to get her to roll back, all right? And then move the pillow, cover her up, get her up high, give her her call bell, and give her some privacy. Any questions about that?
And you number 1 and number 2 in those
Yes,
little
you can.
pans.
Absolutely. Now, the thing that's a little bit tricky with these liners is that it absorbs some of the urine. So if your patient's on strict output, it might affect your output a wee bit. So sometimes we have to put a Foley catheter in so we can get strict output, right? Because that material can absorb moisture. So that's just one thing to consider. This bedpan is the exact same way. If your patient can bend their knees and lift their pelvic region up high enough, you can slide it underneath. If they can't, which most can't, okay, let's face it, it's mainly our seniors we're putting on here, you'll have to roll them. So I'm going to show you a little trick to this one, because it's a bit trickier. So we'll move this, we'll get her on her side. Oh, I like to powder, put some powder on this, okay? Your bum, sometimes people sit on these for a long time, and it sticks, so when you go to move it, you'll rip their skin. And remember, our elderly, their skin is so thin and fragile, so I always powder my pan first, okay? So, I'm going to line this up, so same thing. You want this hole to be right at the bum crack. And then as she rolls, I need to push down and get her on this. Okay, so on the count of 3, you're going to roll. 1, 2, 3. Do you see this? So I had to push down and almost get it, like pop her up on it.
It almost seems too low, doesn't it?
What
Is that one more comfortable?
No.
No?
And there's no way she could have any sort of bowel movement or anything.
That one is like sitting on the dustpan. Like
Oh.
sit on the dustpan and you will know.
Okay, so see what happens is that you have to have it where it is, because as you sit up,
Yeah.
she's pushing forward.
you feel like you're gonna fall off, Tim?
It's so uncomfortable.
Yeah, you guys are going to get on these so you can feel them. You need to feel what this feels like. It's unbelievable.
You do not want
Really?
a bony butt.
Yeah, like I don't even know how, if this ever has to happen to me, I'm holding everything. It's all coming out. Okay, so that's that. Okay, call bell. And then you need to make sure for men, often what I'll do, because it might be very difficult to aim their penis into that little hole, so what I'll do is I'll give them their urinal. You can go ahead and put your penis in there. so that you can void and have a bowel movement at the same time. Okay, so that's what I'll do to help females, just because the anatomy, usually it'll just trickle down. Yes. These are my...
It's hard to keep their dignity while doing
It
this
is.
too.
It's very hard,
Some
right?
people must get really upset.
They do, and you.
Oh,
So
that's
I don't know if any of you have ever been constipated, and you don't have to admit to this right now, but you are anxious anyways, or let's say you have diarrhea,
Yeah.
okay?
Yeah.
And you need to get on that pot right now. Could you imagine this?
No.
No.
No. So
That's fine
be
when it's
patient. Be patient with your patients. Really, you know, give them privacy. Lots of reassurance that, you know, they can do it. It's okay. And very much people are very concerned if they have a bowel movement of the odor. So if you have, you know, if you can open a window, or if you can get some oranges with some cloves in it, just to help, because that's often what people are most concerned about. Okay. So today, get on those so you can feel what they feel like.
Do you happen to have any tricks of because like if you have a sensitive gag reflex
Oh,
for the
yeah,
smell?
sure. So pop a piece of gum in your mouth is good.
We're not allowed.
Okay, can't have gum. Okay, so this is what I used to do, and you can make fun of me. I would put some Vicks on my nose, or in the beginning, you know the Vicks that you could...
Yeah.
Okay, so when I knew I was going in to do something that I knew wasn't going to be great, okay, so then you just have that nice Vicks smell in your nose. And when we do ostomies, when I go over it, the smell can sometimes be very strong. Most people don't object to wearing a mask, and then you can put some Vicks under your nose, so then it'll sort of just trap everything.
So then say for example they smell the Vicks and automatically suspect you have a cold and get mad. Like, what do we do about that?
If you have a cold, I'm sorry, I didn't understand. I'm sorry.
No, like if we go
Put a
into
mask?
whatever, no, and then we put Vicks under our nose and they smell it
Oh,
and automatically assume we have a cold and that we're sick.
oh.
What do we do about that and they get mad?
Well, I've never really come across that. Like, you're not putting, like, huge amounts. Like, it's not like you've lathered your chest. Your back with
Oh
it.
yeah, I know, but like, 'cause
Yeah.
the smell is so strong
Yeah.
for that.
Well, those are my suggestions. Maybe you could come up with other ones. I'm not sure. You'll find that in the beginning it's tough, but probably 2 weeks into it, those sorts of things that really bothered you won't anymore. Your tummy gets strong as a nurse. So, you know, help each other work through it. If you got to take a break and have your partner take a little bit and then come back in, then that's what you got to do. Okay? All right. I think that might be good for now.